You may begin.
We got all kinds of people here this morning.
You may begin.
Good morning. Thank you for joining us this morning. I'm Janice Mathis. I'm Executive Director of the National Council of Negro Women. And I want to thank Dr. Cole, our National President and Chair of our Board of Directors, as well as our NCNW affiliates, our Executive Committee, the state and section representatives who've joined us this morning for what we consider to be a groundbreaking announcement. I also want to express sincere appreciation for our NCNW team members, starting with Mr. Johannes, our Communications Director, Crystal Ramser, our Chief Operating Officer, Membership Director David Glenn, Ms. Sandra Green, our Graphic Designer, Rosalind Hannibal Booker, our relatively new but very effective Director of Philanthropy, for the critical role that each of them has played in this effort that we roll out today. The National Council of Negro Women, affectionately known as NCNW, representing more than 2 million women of African descent, has formed a partnership that we're very proud of with Vaccinate Your Family, one of the nation's foremost immunization advocacy nonprofits. We are coming together to provide reliable information about immunization generally and the COVID-19 vaccines in particular. We are especially focused on specific communities being devastated by the pandemic: Black folk, poor folk, and those in rural areas with limited access to health care. The goals of Good Health Wins, which is what we call our project, Good Health Women's Immunization Networks, Good Health Wins, are to help end the COVID-19 pandemic, which is wreaking havoc on communities of color, lower income families, and frontline workers. I've been working at home since March, and I've been impressed because every Thursday morning, the gentlemen from the County Department of Sanitation come by to pick up the garbage. They're never late. They're always polite. They do essential work, and they are some of those the most exposed to the ravages of COVID-19. We also hope to promote candid conversations and mutually respectful relationships between Black women and health policy officials. We need to be at the table as these policies are rolled out. We hope to increase public understanding and acceptance of immunization as an essential path to good health. And while we're doing all this, we will also encourage WWW. Remember, wash your hands, watch your distance, and please wear a mask. The initial launch of Good Health Wins will focus on Georgia, Florida, and Texas, 3 states with comparatively low vaccination rates and very diverse populations that are spread across urban, suburban, exurban, and rural localities. We've already started to galvanize our network of 2 million women to work in concert with each other and with Vaccinate Your Family in their local communities. Some of our state leaders may be with us this morning: Shara Denton from Georgia, T. Solomon from Florida, and Dorothy Chimney from the state of Texas. We know the historical and socioeconomic reasons that many African Americans are hesitant to embrace vaccination, including the COVID-19 vaccines. We have the most dangerous jobs, often at the lowest pay. The social determinants of health are real in Black communities. But despite the history and the record of abuse, there is an urgent public health need to encourage understanding of the COVID-19 vaccines. Consumers deserve to understand the basic science undergirding immunization and the rigorous layers of efficacy and safety procedures that vaccine candidates undergo prior to authorization or approval. We know that transparency will aid in public acceptance. The more consumers know about the efficacy and safety procedures prior to authorization or approval and the systems in place post-approval, the more apt they will be to accept immunization generally and COVID-19 vaccines in particular. As I think about this issue and realizing that in a few weeks we will celebrate Dr. King's birthday, I have been repeatedly reminded of a saying of his: we are all tied together in an inescapable network of mutuality. Dr. King's well-known quote from Why We Can't Wait, published in 1964, is this: we are caught in an inescapable network of mutuality, tied in a single garment of destiny. Whatever affects one directly affects all indirectly. That phrase keeps ringing in my mind. No matter our color, our ethnicity, our income, whether we are blue states or in red states, when it comes to healthcare, we are all in this together. At this point, I would like to pause and introduce someone who has been an inspiration to the entire NCNW family and really much further beyond. Janetta Betch Cole resides in Florida, but her influence is felt across the nation. She is a noted anthropologist, a prolific author. She's got a book coming out in just a few weeks, I believe, of African proverbs. She is an expert in diversity and inclusion and counsels some of the most powerful corporate executives in the country in that regard. She's been an advisor to movie producers. And of course, we know that she was president of Spelman and of Bennett College, the only person to preside over the only 2 colleges for Black women in the country. And she's been a museum director. Please join me in giving a warm greeting to Janetta Betch Cole, President and Chair of the Board of the National Council of Negro Women.
Thank you, Sister Executive Director, Attorney Janice Mathis. And a warm greeting to all who are participating in this very important convening. At the National Council of Negro Women, affectionately known as NCNW, we understand the wisdom in an African proverb that says, if you want to go fast, go alone. If you want to go far, go together. That is why NCNW is in partnership with, why? I need to say this correctly, in partnership with VYF. Can I get this straight?
VYF.
You see, I know it when I can say the whole thing, but when I get to the alphabets, I always stumble. Vaccinate your family.
Excellent.
Did I do well?
Perfect.
Good. Get an A+ for that. Working together, we are convinced that we can provide accurate and reliable information to communities that are disproportionately affected by the COVID-19 pandemic. Our partnership will last beyond the crisis that we are in, the health crisis that we are in. NCNW looks forward to partnering with VYF on the very question of vaccinations. But right now, we must focus. We must have a laser beam focus on helping our communities to have the information they need in order to make good decisions about the COVID-19 pandemic. In African-American communities, some of the skepticism about vaccines stems from knowledge of something that happened years ago. Of course, I'm referring to the Tuskegee syphilis study. That lasted for 40 years. It was the most infamous biomedical research study in the history of our country. And so even today, among many African Americans, there is a distrust of the very notion of participating in something that is government organized, as indeed was the case with the Tuskegee syphilis study. We think, no, I'm going to say, we are sure that the National Council of Negro Women is trusted. We have earned this trust among African American communities because we've been working in the interests of African American communities for 85 years. Indeed, NCNW has as its mission to help to empower, to advocate for Black women, our families, and our communities. And we know that in African American communities, it is women who often make decisions around the health, not only their own health, but the health of their families. We have a network. We have a network of 32 national women's organizations. We have 300 community and campus-based sections. When we put all of this together, NCNW is serving more than 2 million women and girls. We're an organization of organizations. That's what our founder, the legendary Dr. Mary McLeod Bethune, said when she founded this organization 85 years ago. We're an organization of organizations in the sense that NCNW, our affiliates include well-known and very distinguished and powerful organizations, such as the National Association of Black Nurses, the Links Incorporated, and African American sororities. Our programs are founded on 4 foci: health equity, STEAM, we rather say STEAM so we get the art in, science, technology, engineering, arts, and mathematics education. Thirdly, financial literacy. 4th, civic engagement. Our long-standing concern about health disparities has been greatly increased by the disproportionate ways that the COVID-19 pandemic is affecting African American communities. NCNW partners with the Delta Research and Education Fund to make sure that pharmaceutical research includes Black people in clinical trials. And NCNW is nationally known for Sisters Informing Sisters. This is an evidence-based HIV prevention intervention that has successfully increased awareness among college co-eds of the facts surrounding HIV transmission. In 2005, as part of a strategic initiative to promote the health of Black women, NCNW published a collection of essays under the title, Tomorrow Begins Today. African American Women as We Age. The book remains in print. I have shared this information about some of NCNW's programs, not to brag, not to boast about our organization. I did so to provide insight into why NCNW is a trusted organization that can partner with VYF to build acceptance in African American communities that are understandably skeptical of the COVID-19 vaccine. At NCNW, we look forward to partnering with VYF to go far in providing reliable information about COVID-19 vaccines and to provide that information to communities that are disproportionately suffering from the worst pandemic in this century. Thank you for listening.
Thank you, Dr. Cole. We know that you have another engagement in just a few minutes, but we're so glad you could join us this morning. We appreciate your confidence and support. At this point, I want to introduce the leader of our partner. She's Executive Director of Vaccinate Your Family. It's hard to believe from looking at her. She's been doing this work, she says, for 25 years. But when you read what she writes and you read what she posts online, you understand that she is truly an expert and advocate for immunization generally and for the COVID vaccines in particular. Please join me in welcoming Amy Pisani from Vaccinate Your Family.
Thank you so much, Janice. And Dr. Cole, both of your comments are so moving. You know, we've been working on this partnership for months now, and I feel thrilled that today has come. I know that between Vaccinate Your Family and NCNW, we're going to make things happen and quickly because we have no time to waste when it comes to COVID-19. Our founders, former First Lady Rosalind Carter and Betty Bumpers, who was the First Lady of Arkansas and later came to Washington, D.C. for over 20 years when her husband, Dale Bumpers, was elected to the Senate. They really believed in the fact that every single human being should have access to vaccines. And they spent over 30 years on this mission to get access to everyone. I have actually been here for 25 years almost. I did start in my early career in public health, and it has been the greatest pleasure for me to be a part of the public health community. Hearing all the things that Dr. Cole talked about with the sisters in NCNW, it does really remind me of the way that we in public health feel about one another. We fight for equity in vaccinations every day, and we've had some great wins. And so I'm going to start with the really great news of last night, and then I'm going to talk about some of the challenges that we do have ahead of us. So our efforts really focus on educating the public about the importance of timely immunizations. And then we also do a great deal of work. Erica is an amazing advocacy director for us. We do a lot of work in the policy arena, ensuring that there's access to vaccines and great policies that support vaccinations at every level. So fortunately, last evening, we learned that Congress did, in fact, authorize the $8.75 billion to distribute the COVID-19 vaccines and educate the public about those vaccines. It's such great news. These are really, I mean, this has been the cornerstone of efforts of Vaccinate Your Family and our partners ever since the pandemic started. We have been decrying the fact that, wonderful news that there was money given to create the vaccines. Now that they're here, we hadn't seen any money to ensure their distribution. And that's so important because you know, although the vaccines are free for the time being, it's not an easy effort to just get vaccines to every single person who wants them. It's not as though you just drive them in a truck and they get into the arms. Without the efforts of public health, we are going to miss huge portions of the population who tend to be at risk in any case. So this is already the case with regular vaccinations, and it is completely untenable with COVID-19 because, as you know, and as you mentioned in your talking points, COVID-19 has been absolutely disastrous for communities of color. The disparities have been insurmountable without a vaccine to help. And so we're really excited right now. This partnership with NCNW will be critical to helping high-risk communities understand not only the burden of COVID-19 disease, but also why it's important to receive the vaccines that have been created, and how they are really going to be the foundation to ensuring a lifetime of good health. Both COVID-19 vaccines and other vaccines that disproportionately are not received by communities of color. So those are the good news pieces. On the bad news front, we do have some challenges ahead of us. And this is why I think our partnership, it is so timely. And I love the fact that you have the boots on the ground. We have our expertise in vaccines, along with all of our partners. We have an amazing board of directors filled with medical experts, scientific experts, and my staff. I have a wonderful staff that works to try to educate the public every day about vaccines. So our biggest challenges that we do have are anti-vaccine leaders who specifically target close-knit communities. They try to spread disinformation on the safety and efficacy of vaccines in these communities. And they do have an impact. They impact the confidence in vaccines, and they have been the direct cause of several measles outbreaks in this country in recent years. Measles matters, and it matters particularly now because you can see how infectious COVID-19 is. Measles is also incredibly infectious, and it requires a very high community immunity level in order to keep it at bay. You can't just vaccinate a person and they will be automatically protected from measles. Everyone around them has to be vaccinated, and that's the same with COVID. So these are the kinds of principles that we need to help instill in, in Georgia and Texas and Florida, and frankly, all the places where we're planning on going into the future, which I know Synovia and Erica will talk about. So last thing I'll say is that after decades of work in eliminating racial vaccine disparities among children through the Vaccines for Children program, much of which was our co-founder's passion, we're looking at the possibility of those disparities creeping back in. They've never gone away for adults. We've seen that white individuals are vaccinated at higher levels than any other community. And so we have our work ahead of us, but I know through this partnership, we're going to make great things happen. We are completely dedicated to ensuring that everyone has not just equitable access to vaccines, but also to the vaccine information that will make them confident in their decision to not vaccinate just themselves, but also telling their loved ones why it matters and how it will help us get through this pandemic and keep us safe into the future. So we're thrilled to be here, and today is just the beginning, but next year is going to be an amazing partnership. So thank you for including us.
Your expertise and your willingness and your positive spirit and all the hard work. We have been meeting for a couple of months now, and to see it finally in the public where people can ask us questions about it is pretty cool. Every partnership, I'm going to call them the brains of the outfit. Erica DeWald is a lawyer, I think, by training, but she is advocacy director for Vaccinate Your Family. But she's one of those practical lawyers who can take the legalese and make it make sense for everyday consumers. And that is so important to be able to do that. Take these complex subjects and turn them into something that is digestible. So that's Erica DeWald. And my other partner in this effort is Synovia Moss. Now, Synovia and I met. She tells me it was happenstance. I was in Wisconsin for a speaking engagement, and she came up and said, I wanted to meet you. So I used to run something called Black Family Reunion. If you know anything about NCNW, You know that Black Family Reunion was a huge, millions of people came out for Black Family Reunion each year. Zenobia, when she was a very young woman, helped to plan and actually direct portions of Black Family Reunion with Dr. Height at NCNW. She came back to us with this idea. This is a project that NCNW is ideally suited for. So at this time, I'd like for Erica and Zenobia to fill in a little of the detail about where do we go from here, what's next, what modalities will we use, about the geography. Whoever wants to go first, my two friends, Zenobia and Erica, I'll leave it up to you as to who goes first.
Well, thank you. And we are very excited to officially launch the Good Health Wins program as a rapid response opportunity here in Georgia, Florida, and Texas as phase one of our scope of work. As we shared that this is a multi-state, multi-generational messaging and mobilization of African-American women to advocate and implement strategies for improving awareness and other vaccine-related community engagement efforts. Good Health Wins is tactical and it's practical. It's a partnership of content expertise of VYF and the contextual expertise, the grassroots community organizing work that NCNW does so well. So in phase one, we'll look at those initial 3 states. And in phase two, we will take aim, do advocacy, immunization, information, and mobilization. Our Take AIM program will train the 300 sections and our national affiliates around immunization information. So Good Health Wins, our response program, will integrate a variety of tools, activities, and services into a coordinated campaign, including a custom website, opinion editorials, speakers bureau, a resource guide toolkit, and most importantly, culturally sensitive media engagement. And our efforts will include both our small and large group discussions with our members, civic, social, and faith-based organizational engagement, and community health infrastructure to do the bridge building work of the information and the science. Good Health Wins will be carefully calibrated to comport with scientific findings and available data. Erica, you want to share more?
Thanks so much, Zenobia. Yeah, and this isn't just about building trust. This is also about building trustworthiness. So as we're working with NCNW to make sure that advocates have access to real information, information that they can understand and share, we also want to make sure that CDC, NIH, HHS, state health departments, local health departments understand the steps and the conversations they need to have to prove their trustworthiness to those individuals in the community who are now taking that leap of faith based on the information provided to them by NCNW and Vaccinate Your Family to vaccinate themselves and their families. And just to clarify, I am hands down the least educated person on this call. I play a lawyer on TV. I've also played an MPH on TV, but I unfortunately am the least educated on this call. It's an honor to be with all of you women today.
With that, we will conclude our sort of prepared remarks. We know that Dr. Cole had to leave us. I see that Rosalind Hannibal Booker has joined us, our esteemed Director of Philanthropy. Are there any questions from the media? I see at least 2 active members of the media. Do you have any questions for us this morning?
Yes, good morning. Portia Monique with Rolling Out Media Outlet. Thank you, ladies, for doing this forum for us this morning. Zenobia, you touched on it a bit, but can you go into more detail about just keeping in line with the Good Health Wins, the goals of COVID-19, controlling the pandemic and increasing the public understanding and acceptance of the vaccine? Can you touch on a little bit more of how NCNW and Good Health Wins will play a role in educating our community about the vaccine?
So as one of our program goals, it is to create this immunization network and a delivery system. And so we will begin with surveying the membership within these 3 states so that we can get a deep dive of really understanding what's happening in depth in these communities as far as how do we really feel? how are we really handling the vaccine confidence and the hesitancy? From that survey, which is going to help us to better inform our evidence-based work, we'll take this information, we'll analyze it, and then we'll do what NCNW does best. We will begin hosting virtual listening sessions in the 3 states with our subject matter experts to facilitate the conversation with the community and especially with African American women.
I love that.
Would either Amy, you or Erica want to add anything? Feel free.
We are just really excited. You know, African American women and all women, frankly, are definitely the decision makers when it comes to health. And so I think when our partners at NCNW, you know, focused on that, both Dr. Cole and Janice, that's so important because our founders were women, obviously, as well. And they really did believe in coalition building. They literally went to every state in the United States of America and built an immunization coalition because they knew that it was the leaders at the local community level that make a difference. And so this partnership combined with our coalition building efforts, I think, will be the answer to what we need. Again, it's timeliness. We don't have time to waste. We have to save communities. We have to save lives right now. So between the on-the-ground expertise between NCNW and our expertise in vaccines, and Erica is an expert. Don't diminish her contribution. She may not be a lawyer, but she does play one well. We're really set to go.
As a follow-up question to that, and staying in that same vein, how will you all partner with Black-owned media?
Well, you know that Rolling Out is one of our most stalwart partners, and we're so glad that you could be on with us today.
Thank you, Dana.
We are gathering resources in order to do this work. I mean, we're writing, we're thinking, we're talking to people who have access to resources. And as we receive those resources, some of it will be spent, frankly, with Black-owned media, because we know that often in these conversations, you sort of get maybe left out. People don't understand the power of your digital platforms and how young folk especially tune in to your daily shows and your networks. So you will see us doing a robust effort. As a matter of fact, right now, NCNW is running radio ads that we paid for in Georgia, in Augusta, Athens, Columbus, Macon, Savannah, Valdosta, because we want people to go out and vote. We don't presume to tell them how to vote, but we want to remind, and we're partnering with Black-owned radio stations in those cities. So we think that our record of engaging with Black-owned media sort of speaks for itself. And if you will be meeting with the powers that be at Rolling Out to talk about that, because media matters. Young folk live on their devices.
Yes.
And if we want to get to them, we've got to get the messages to where they are. So thank you for that question.
Thank you so much, Janice.
Are there any other questions? I see Robert Patillo, who does time on Fox and on radio in Atlanta and around the country. Robert, do you have any questions for us today?
Certainly. Of course, thank you so much for inviting me, Attorney Mathis. My question would be, how could like-minded organizations become involved to help spread the message, to help bring more people in? With Rainbow Push, we've had conversations with Dr. Fauci, Dr. Redfield, Dr. Collins, General Perna, Dr. Slawi on the virus or on the vaccine rollout. But what can other organizations do if they want to become involved and want to partner with you?
You know, Rainbow Push has a powerful network too. You're on radio, you're on television. I think the first thing is to let people know what your messaging is about it. We know that the guy who came up with Keep Hope Alive is expert at converting complex topics into pithy phrases that live forever in the lexicon. So put Jesse to work coming up with some good phrases for us to use. That's one thing you can do. The other thing is in your small group gatherings, 1,000 Churches Connected, the Trade Bureau, insert some of this language and these messages into your everyday conversations that you're having. I remember when HIV was just ravishing and scaring everybody witless. Rainbow Push was one of the first organizations to have pastors take the HIV test in the pulpit. Can you remember back that far? You might have still been a student.
No, I can remember indeed.
But that's the kind of engagement that we need. I would like to see the 1,000 Churches Connected pastors taking and encouraging others to take the vaccine from the pulpit, because they have a lot of moral suasion. Of course, there are other cultural entities, the athletes. I'd love to get some of them involved in this, but we will be reaching out far and wide, both to our networks and beyond.
Thank you so much, Attorney Mathis.
You're welcome. My pleasure. Are there any other questions? Rosalind, I see that you're on. Rosalind Hannibal Booker is our Director of Philanthropy, and I don't know if you wanted to make a comment, because you certainly have been part of this in the trenches with us as we tried to thrash this all out.
Thank you so much. Yes, my one comment is that we certainly are pursuing individuals who would like to partner with us for financial support, and that we are in a thinking process of how we can expand our resources. And so those individuals who are interested in helping to partner with us to provide resources, certainly we would want to begin having conversations with them and ask that they contact us.
I'm glad you mentioned that, Rosalind, because this will indeed be a ground up effort. Whatever resources we gather will be shared with our local, state and local affiliates and sections, because we need to spread out a broad net. This can't come in a funnel down from DC. This has got to be felt by communities right where they are, where they shop, where they get their hair done. I'm thinking about the National Association of Beauty Culturists League, so make sure that we're in all the beauty salons and hair weaving places, so that we can be where our communities are and they don't have to go hunting for us. We go looking for them. With that, unless there are other, I see that some of our affiliate representatives are on the line today. If any of them would like to make a comment, Dorothy White from Isle of Philander, you certainly may.
Thank you, Sarah. I'm sorry. I'm calling you Sarah.
I am Sarah.
Attorney Mathis. Thank you for this press conference and giving us the information that you're sharing with us. And the only question I had was just answered by you. I was wondering how you were going to roll this out to the affiliates, the type of information that you'll be sharing with us, and when you would be sending that out.
The timetable is not quite set, but before the middle of January, before Martin Luther King birthday celebration, you will start to see messages from NCNW, and they will come over the internet and the email. We'll be having Zoom calls, webinars. There will be a lot of information sent out, and we're just hoping and trusting that our 32 affiliates will engage in this with us. We're counting on you. So if you help us spread that back to the sisterhood, we would appreciate it.
Thank you. I certainly will.
Appreciate your being here. Are there any other comments before we adjourn? Okay, I see someone connected. Good morning. Colette McCurdy Jackson, would you like to make a comment?
Good morning. Thank you.
You're more than welcome. How are you this morning?
I'm fantastic. No, just very glad to see NCNW involved in, getting our community informed and allowing us, the necessary information to be able to make an educated, informed decision on how we approach the vaccine. So thank you for your involvement and for, of course, involving us, the affiliates as well. Thanks.
For our friends who don't know you and your organization, tell them a little bit about your organization, if you don't mind.
Oh, thank you. Eta Phi Beta Sorority Incorporated. We are a business and professional women's organization founded in 1942 on the campus of Lewis Business College in Detroit, Michigan.
We thank you for that. And of course, you have chapters all over the country, as does Alpha Phi Lambda. So we're going to use, we talk about 2 million women. This will be an experiment to see just how many of those 2 million women we can touch and activate. and make that association, that affiliation as real as it has ever been in Dr. Height's time and in Dr. Bethune's time. This is our 85th anniversary. So we're gonna give it all that we've got.
Wow. So Janice, that's going to be great because it's our 30th anniversary next year. I think we're going to have, it's over 100 years of experience. So
That's right.
that's important. And it's really, I just want to mention one thing. So this is about getting COVID-19 vaccine out as quickly as possible. But it's also about changing the infrastructure and making sure that these women who you have in your network, who are so powerful and educated, become ingrained in the policy decision-making processes moving forward. And so we want to make sure that you're being recommended to be on panels, whether it's at ACIP, the CDC or FDA, or at state and community level policy-making tables. This is where we need to make the differences in our next phase.
Amy, I am so glad that you brought that up because I didn't realize the extent to which county boards of health and county health departments and state organizations and national coalitions, there's a whole network of folk who do nothing but talk about and develop policy and practices for immunization. And by and large, they went and got the president of Meharry Medical School to be on one as a temporary voting member, because I think they looked at their list and they didn't see too many people of color. And so they had to add somebody at the last minute. But we need to get to some of those tables. And you know what they say, if they don't have a seat for you, what do? We bring a folding chair.
Well, I think that's really important. And I think people are starting to really recognize right now, as each governor puts together their own panel of experts to help distribute the vaccine.
Yeah.
Here where I live in my state, they have a great representation, and I'm very happy with the people they chose. But we need to make sure that they know who to call on when the time comes, so that it's not just the same people at the table, which is really the problem we're having.
That's what working on a project like this, nothing builds relationships like working on something together, because you won't always agree. You know how it is, but if you can keep the goal in mind, you can kind of work through and around whatever the challenges are. So that's why I love my affiliates. You all know that I try to keep you in the loop on everything that we're doing. But I found some new friends with Vaccinate Your Family, and we're just going to keep expanding this network. With that, I want to thank each of you. You will be hearing more from us. You should, if you're a member of the media, or even if you just want it, there is a press release that we can email to you if it hasn't gone out already. Thank you, and have a wonderful Monday morning.
Stay well, everyone.